How many patients do I have today?
Good morning, Dr. Archer. Well, you have 3 patients in room 1, 2, and 3. The first patient has type 2 cancer, and the second patient has type 1, and the third patient has type 3. I have gone over them the research that I've given them since all 3 of them follow the group ethnic that was studied on in BC. So I was thinking that you could probably go in and ask them if they have any questions.
Perfect.
So there you go.
Thank you, Anita.
Good luck.
Hi, Sophie.
Hi.
Hi. You've been given the package from my receptionist,
Yes.
Anita, right? So you've been diagnosed with stage 2 breast cancer.
Unfortunately, yes.
Okay, so within this booklet, there's a whole study that we've conducted on individuals in British Columbia with different types of breast cancer. Do you have any questions about it?
I have a couple.
Okay.
I was kind of confused on what histology was.
Okay, so histology is a study of microscopic anatomy of cells.
Okay.
In this specific example, we looked at cancer cells, more specifically breast cancer cells.
Okay. Also, I was really confused on what an HER2 gene was.
Yeah, that's a common question. So the HER2 gene is a protein called human epidermal growth factor receptor 2. This specific gene promotes growth of cancer cells from mutation.
Okay, and why did you choose Chinese, South Asian, and Iranian women?
Okay, so within this study, we looked at 915 South Asians, 1,958 Chinese, and 136 Iranians.
Okay.
We used these groups for the study to look at racial and ethnic disparities, stage of diagnosis, survival, and mortality rates.
Okay.
We use them basically to look at the different treatments that are received by patients within British Columbia based on their ethnicity, because it's received little attention to date. There's been a lot of studies done on breast cancer, but this has just not received a lot of.
Okay. Well, I think I've definitely decided what kind of treatment I'd like to get then.
All right. Well, if you have any more questions, feel free to book an appointment with Juanita and come back.
Thank you.
Okay. Good morning, Darya. Have you had a chance to go through the package that Juanita provided you with earlier?
Yeah, I have.
Okay. Do you have any questions?
Yeah, I do.
Okay. Let's
My
work through
first
them.
question was, do different groups have different types of cancer?
So it was found that most groups do have different types of stages in regards to cancer. South Asian women with breast cancer tended to be diagnosed at more advanced stages than the other women.
Okay, so then does that affect who is affected most?
The individuals who are most commonly presented with breast cancer in the article were women. Breast cancer is a leading cause of premature mortality in women across the world. While men can be diagnosed with breast cancer, the chances are not as high as women.
So then should I question the results?
With every study, there should be a general understanding that more research may need to be conducted in order to confirm the results. While this study does make tremendous headway into gaining a better understanding of the cultural and ethnic disparities between treatment options for breast cancer and its different stages, further research will need to be conducted as to why.
Okay then, I think I know what kind of treatment I'd like to get done then.
Okay, well if you have any further questions, you can just book an appointment with Juanita. Sana, have you had a chance to go through the package that Juanita provided you with?
Yep, I have.
Do you have any questions?
As a data analyst, I think I do have a lot of
Alright,
questions.
let's do this.
So what is a basal type of cancer?
Basal type of breast cancer is an aggressive type of breast cancer, most commonly found in African American and West African populations.
Okay, so is the sample size good or bad in this research paper?
The sample size that was identified was approximately 3,009. The sample size was good for this type of study because it generalizes the stats. If we were to choose a smaller sample size, it would be a greater risk because by chance it can be unusual and the randomness will affect the results greatly.
Okay, well I haven't had the chance to go read through the whole entire package. I was just wondering, what did the statistics say?
The statistics tell us that in each category the age median was fairly the same, and a lot of participants were diagnosed during either stage 1 or stage 2 of breast cancer. It also indicates that Chinese women who have been diagnosed with stage 1 or stage 2 breast cancer are less likely to receive surgery with radiation than the others. In addition, the statistics of the study indicate that there was very little difference between chemotherapy and hormone therapy treatments between the groups.
Okay, so then from your perspective, what is your advice?
I would provide my patients with a heightened awareness for screening for friends and family, as well as regular checkups in order to prevent the more aggressive types of cancer. I would suggest this to my patients so that diagnosis can be made at the earlier stages so that the treatment options, if they do select, are more effective and optimal results can be achieved.
Okay, well, I think I know what kind of treatment I'd like then.
Alright, well if you have any further questions, talk to Anita and she'll schedule you an appointment.
Okay, thank you.
Bye.